Hi, this is Brian Kim. I want to share with you case number 143 in the Best Way to Do Cataract Surgery series. This is a cataract, a hypermature cataract, and you're going to be seeing trypan blue staining and then terminal chop to create a central sculpting groove, and then performing terminal chop to crush and bisect the lens in half, and then cross chop techniques and mechanical fracturing techniques. And you're going to see how I'm able to very easily pull pieces up out of the bag using the chopper. And doing it this way, you will never again struggle to pull pieces up out of the bag. And so you can see how dense this lens is. I'm using a cotton tip to steady the eye and using a corneal marker, which will help me to center and size the rexus. Again, I'm using a cotton tip to steady the eye and making a paracentesis incision parallel to the iris plane on the right side and then the left side. And by doing it that way, I'm able to create a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine, and then some intracameral epinephrine, and then some intracameral air, and then some trypan blue. I'm going to paint the anterior capsule surface this way. And again, I don't like to flood the eye with the stain. Yes, I can get more brilliant staining if I just flood the entire eye, but I want to protect the corneal endothelium. I don't want that dye to be there on the corneal endothelium, and I just need a little bit of dye to see what I'm doing. So now I'm pushing the dye and the bubble out with the dispersive viscoelastic, which will coat the corneal endothelium and flatten the anterior capsule. So again, you don't need brilliant dye in order to do the case. And so is it worth staining the eye really, really well and exposing the corneal endothelium to that potential toxic dye? So this is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then enter. And because this is a dense lens, and because I don't have sharp tip capsulorhexis forceps, I decide, you know what, I may just go ahead with the cystotome, but before I do that, let's go ahead and remove that bubble. And this is while the sharp tip Halde Percars were being manufactured and developed. And so I'm going to go ahead and use the cystotome instead. And you recall I used the sharp tip Halde Percar. It's basically a 2-in-1 instrument. It's a cystotome and rhexis forcep all in one. But these are the blunt tip Halde Percars. Once I puncture with the cystotome, you can see this is not an intumescent lens, so I can confidently make the rhexis. I'm grabbing the edge of the tear, creating a flap, going around circumferentially. And again, you can see how low of a profile these forceps have because of the way the teeth are designed. I'm able to go around circumferentially. I have excellent control. I'm not having to pull inward constantly with these forceps. And then you finish off the rhexis. Burp some viscoelastic out. And this is the capsular fornix hydrodissection technique. I place the cannula underneath the rhexis edge contra-incisionally, point the tip down. I get a nice wave, but I can't see it, which is fine. I know I did it. And then decompressing on the left side, and you can see very easily the lens begins to spin, hooking the peripheral lens from the right. I'm going to switch to sculpt mode here because I'm already deciding I'm going to be sculpting for the terminal chop. I'm extending the sleeve a little bit, irrigating the surface of the eye, lifting the incision with a chopper, removing the surface epinuclear material, going bevel up now, and I'll go ahead and start sculpting here. You can see on this setting, I don't have any longitudinal, I'm only using torsional. So I have to be mindful that I'm not able to get really aggressive sculpting here, but good enough that I'm able to get a nice trough. You don't want to push down on the lens too much. You want to be very gentle on the zonules when you do this. But you can see how tough this lens is. It's not just sucking out the lens material. It's quite dense. And remember, with this technique, you don't have to get all the way down to the posterior capsule. When you do it that way with a standard divide and conquer, you can actually, get close to the posterior capsule. That's pretty dangerous. I'm just going to place the chopper on the edge here, and then this is the terminal chop. I'm able to fracture the lens from the equatorial side, and it propagates all the way across. In this case, it propagates about 70 to 80%, but this is cool. See, I'm going to try to separate. You saw I spun the lens here. It just kind of happened. And it's not separating. I place a chopper around it again on the equatorial side, fracturing from the terminal side. And look, you saw that maneuver. It just fractured that lens. You saw that sudden loss of resistance and the lens split. And now it's completely severed into two heminuclei. I place a chopper around the lens piece, position the phaco tip vertically. By doing it that way, you're getting better opposing forces around the lens piece. You can see I'm using vacuum to grab that lens, but it's not coming up. And so I'm going to use a chopper to get around the lens piece, fracture it again. By placing the chopper around the lens, I'm able to mobilize that piece a lot more easily. Again, rather than utilizing vacuum, trying to grab it with vacuum and it's slipping off and then slipping off again and slipping off, getting frustrated. Again, using vacuum as a sucking maneuver, trying to pull pieces up with the suction. But if you can just place the chopper around the lens piece, fracture the lens, and you can usher it up by just teasing the lens piece up with mechanical forces, it's just so much more easy to mobilize these lens pieces. Again, these dense lenses are all jigsawed together, and by placing the chopper around the lens piece, fracturing the lens in half, this further loosen up the lens pieces and pull the pieces up out of the bag. And so that's that second quadrant. Place the chopper around the lens piece, again crushing it with opposing forces between the instruments, and then crushing the lens piece into smaller and smaller pieces, and then emulsifying the lens piece. And so that's really, again, the highlight of this technique on this case is, when you have this dense lens, you try to grab it with high vacuum, you're going to impale it, you're going to keep sucking it, it might slip back in, and you just get frustrated. Again, why put yourself through that frustration? Place the chopper around the lens. Get comfortable putting your instruments out there. It's not that dangerous, and it's really the best way to get at these pieces and mobilize these lens pieces. Again, so you can see that second heminucleus, I've placed the chopper around the lens piece, pull it towards the phaco tip, which is positioned deep in the bag, crush it in half, again, using no ultrasonic energy or vacuum for that maneuver, and then crushing the lens again, that third quadrant in half in the same manner. Again, all of this is just with viscoelastic and irrigation fluid. That's it. And again, I'm able to disassemble the lens completely, and then using some more crushing forces to break down the pieces into smaller and smaller and smaller pieces. And once they're small enough, I start to use some high vacuum and pulses of ultrasonic energy to remove the lens pieces. So you can see here the ultrasonic energy is in double digits, but most of that was performed during the sculpting maneuver at the early beginning part of the case. And again, you have complete coverage of the corneal endothelium in the beginning of the case. And so I do feel confident that even though the CDE is higher, this is at the very early beginning part of the case when I'm sculpting. So I think there's good corneal protection during this maneuver. So this is the final quadrant. Again, I'm using crushing forces to crush the lens in half with the instruments. Again, sandwiching the lens pieces, positioning the instruments around the lens pieces, and then crushing the pieces into smaller and smaller pieces, and then emulsifying the lens pieces. When you have the final fragments, you want to really make sure you don't activate vacuum when you're doing the chop maneuver. You might have post-occlusion surge, and then the posterior capsule can come up. So you always want to protect the posterior capsule with the chopper whenever you're engaging ultrasonic energy. So now I have the epinucleus. I'm just very carefully trying to grab the anterior edge of the epinucleus, and it just comes right out. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. You see that thick epinuclear cortical material so that it tumbles out quite nicely there. I'm using foot pedal control to see if I can remove some of this cortex and then I switch to polish mode. I do feel like in these situations, dense lenses, if you're too aggressive with the vacuum, you might actually grab the capsular bag and stretch the zonules. So I don't hesitate to switch to the polish mode, and going on the low flow setting, I feel like it's much more zonular friendly. Of course, if I grab a big chunk of cortex, I can switch to cortex mode, remove it, and then switch back to polish mode very quickly. So again, I'm polishing underneath the rexus edge, circumferentially, polishing the posterior capsule as well. You can see there's a lot of adherent material on the capsule. Pulsing BSS into the subincisional capsular fornix, which looks clean. Injecting some cohesive viscoelastic to fill the capsular bag. Again, this is a shepherd polisher. I'm going to polish around the rexus edge. Again, this is fairly bulky, but with some practice, you can see it works really well. And look how nicely the shepherd polisher removed that stubborn cortical material off the underside of the anterior capsule there. Switching to the Singer sweep side, widening the incision with my paracentesis blade because I'm going to be injecting a 3-piece lens here. Turn the bevel to the left, advance the lens. The leading haptic goes into the capsular bag. As the optic unfolds, I rotate my hand so the optic comes out planar. The trailing haptic is left out, and I'm pushing with the multiman at the optic haptic junction and then dialing the trailing haptic into the bag. I go in with irrigation off, activate irrigation, go underneath the optic, remove the viscoelastic from within the bag. And remember, since I widened the incision, I don't really have as good chamber stability. You have to be very mindful during this step when you're doing that. Just rotating the lens a little bit here. And then switching to visco mode, removing the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, you saw terminal chop, which is essentially sculpting a groove. You don't have to go all the way deep, so that's why it's different from stop and chop or divide and conquer. You don't have to see this changing of the red reflex as you go deeper and deeper, you know, the way we were taught. You really have to only go kind of almost halfway through, and then you place the chopper on the peripheral edge, and at the capsular fornix area, you fracture the lens from the equatorial side, and it propagates that fracture deep. So this really conquers the posterior plate. You can see that it didn't go all the way through. So I spun the lens and I fractured it on the other side, and it separated the lens in half. I performed multiple cross-chop maneuvers to sever the lens and break it up into smaller and smaller pieces. And then by doing it this way, I really felt very confident being able to remove the lens pieces without any difficulty. Again, don't grab lens pieces with vacuum if you're getting frustrated. Just learn to place the chopper under the rexus edge, fracturing it from the equatorial side. This immediately mobilizes the lens pieces, and you'll be able to mobilize the lens piece without any difficulty, and you'll be able to disassemble the lens and not have any struggles pulling up lens pieces out of the bag. So I hope this was helpful to you, and I thank you for your attention.